Hello, this video is going to cover caring for clients with upper respiratory disorders. So this is covering the upper respiratory disorders. The first thing we're going to talk about is rhinitis. It is the inflammation of the nasal mucous membranes. It can be acute, chronic, or allergic. Some basic assessment findings are sneezing, nasal congestion, rhinorrhea, which is clear nasal drainage, a sore throat, watery eyes, cough, low-grade fever, headache, muscle aches, and malaise. Medical management, they could give antipyretics for fever, decongestants for severe nasal congestion, antitussives for coughing. They can do saline gargles. This will help with their sore throat. They can do saline sprays for nasal congestion and give antihistamines for allergic rhinitises. Some nursing management would be the prevention and minimizing potential complications. Well, we're going to make sure they are resting. We want to increase their liquid intake as this helps liquefy secretions. Vaporizers will help liquefy secretions. Washing their hands, teaching them to blow their nose with their mouth open to equalize their pressure. If they have allergic rhinitis, we want to avoid allergens, and we're going to have them get tested so that they know what to avoid. It's also showing studies that vitamin C can help shorten the duration. There are not any tests that are normally done. It is usually based on their signs and symptoms. Next, we're going to talk about sinusitis, which is the inflammation of the sinuses. The maxillary sinus is the most common. This can be bacterial or viral, and it's caused with when there's an interference with sinus drainage. And when there's a interference with the drainage, it becomes infected. Assessment findings, you're going to see a headache, fever, pain over the affected sinus, nasal congestion, and pressure around the eyes with possible pain. Medical management, they can give saline irrigation, antibiotics, vasoconstrictors, and nasal corticosteroids. There are some surgical procedures if needed. We're also going to look at nursing management. We're going to provide mouthwashes, humidification, increase their fluid intake, nasal decongestants, and antihistamines if needed. Some tests that can be run here would be a culture and sensitivity. X-rays can be done, CTs, MRIs, or a nasal endoscopy. If they have sinus surgery, the nursing care post-operatively, we're going to observe for repeated swallowing because this can be a sign of hemorrhaging. We're also going to watch the optic nerve function, temperature of every 4 hours. Administer analgesics as indicated. They can apply ice. You may have to look at nasal packages and drainings under the nares. Here's a question. Which of the following statements made by a client with sinusitis would indicate to the nurse that further teaching is required? The answer is D. So we talked about ice packs, but that is after surgery, not for just sinusitis regularly. So making sure you know the difference between sinusitis versus the post-op care of sinus surgeries. Next, we're going to talk about pharyngitis, which is inflammation of the throat. Most common is strep throat. Some complications that they see could lead to endocarditis, rheumatic fever. This is highly contagious and can be contaminated through inhalation or direct contact with droplets. Assessment findings would be your sore throat, dysphagia, fever, headache, white or exudate patches over the tonsillar area, and swollen glands. They could do a throat culture, which is a rapid antigen test, and then antibiotic treatments could be erythromycin or penicillin are the most common. And they could be on these for 5 to 14 days. Next, we have tonsillitis and adenoiditis. Tonsillitis is the inflammation of your tonsils, and adenoiditis is the inflammation of the adenoids. These usually occur together, but usually only called tonsillitis. Primary versus secondary. So if you have primary, this means it starts in the tonsils or the adenoids, whereas a secondary, it occurs from another infection or upper respiratory infections. Assessment findings that you're going to see are your sore throat, difficult or pain on swallowing, fever, malaise, enlarged adenoids, nasal obstruction, and snoring. Medical management could be antibiotic therapy, analgesics, and saline gargles. They can perform a tonsillectomy or an adenoidectomy, usually require 7 in a year or 4 to 5 times a year for 2 years before a patient is eligible for a tonsillectomy or an adenoidectomy. Tests that can be run is that throat culture and sensitivity. Nursing management we're going to talk about here is the surgery. We're going to make sure we're assessing for gag reflexes. We can apply an ice collar. We can help by providing warm saline gargles, which it helps clean and it helps with the inflammation and the pain. We want to make sure that they are avoiding carbonated drinks. Monitor frequent swallowing, because that could mean that they are bleeding. We want to try to prevent them from coughing and blowing their nose. We're going to make sure that they have no straws that could hinder sutures. Question number 2. After a client undergoes surgery to the upper respiratory tract, the nurse should monitor the client for B, airway. Airway is always the primary assessment to be made after a surgery, especially when we're talking about respiratory surgeries. Laryngitis, which remember the larynx holds your voice box. Laryngitis is the inflammation and swelling of the mucous membrane that line the larynx. Assessment findings could be they cannot speak above a whisper, throat irritation, aphonia, which is a complete loss of voice, dry, a non-productive cough. If the hoarseness lasts longer than 2 weeks, they'll ask for a laryngoscopy. Persistent hoarseness is a sign of laryngeal cancer. So it's going to start, that's why after 2 weeks, they're going to do a little more investigating. We want to educate, the patient on voice rest. We want to educate them that whispering actually strains the voice more than a normal speaking. A lot of people, you'll see them try to whisper to help their throat, but actually that is more straining on the voice. We're going to talk about treatment or removal of the cause, provide antibiotic therapy if it's a bacterial, and we're going to talk to them about smoking. Next, we're going to talk about epistaxis, which is actually a nosebleed. This is a rupture of tiny capillaries in the nasal mucous membrane. Risk factors could be if they're a risk for trauma, systemic infections, local infections, dry nasal mucosa, hypertension if they're on aspirin. Those are some common risk factors. Assessment findings, or you're going to see a nasal speculum and a tongue blade reveals bleeding. How do we position a patient who is having a nosebleed? So we are actually wanting to position them setting up, leaning forward to prevent them from swallowing and aspirating. So we're going to lean forward and pinch the nose. Medical management is continuous pressure, ice packs, topical vasoconstrictors, nasal packaging. Some nursing interventions, we're going to monitor vital signs. We're going to monitor for continued bleeding. We can provide humidification, nasal lubricants, and we want to make sure that we avoid vigorous nose blowing or nose picking. Another question here. The nurse is teaching first aid class to parents. The topic is treatment for a nosebleed. One of the parents indicates a need for further teaching when they make the following statement. The answer is going to be B. Flush the nose with warm water. We want to remember warm fluids flushed into the nose should be avoided because it will cause dilation of the blood vessels, and that could exacerbate the bleeding. Nasal obstructions are normally related to a deviated septum or nasal polyps, which are grape-like swellings. Assessment findings could be a history of sinusitis, difficulty breathing out of one nostril, frequent nosebleeds, and nasal drainage. Medical management would be a steroid nasal spray for the nasal polyps. They could have a septoplasty, a rhinoplasty. Some nursing management would be nasal packing, teaching mouth breathing, placing them in semi-Fowler's position, monitor vital signs, and providing oral hygiene. We're also going to provide ice packs, and we're going to monitor yet again for that excessive swallowing. Fractures of the nose, usually related to a trauma. Some assessment findings are going to be swelling, edema of the soft tissue. They can have external or internal bleeding, nasal deformity, nasal obstruction, and we're going to monitor for cerebral spinal fluid with the nasal fluids. The dextrosticks is what determines if there's any sugar present. So that's how we determine if there is cerebral spinal fluid present in the nasal discharge. Medical management would be to apply pressure and cold compresses. Nursing management, we're going to elevate the head of the bed. We can apply ice, provide pain medication as needed, assess for airway obstruction. We're going to make sure we have pupil responses, monitor their level of consciousness, and watch for periorbital edema and help decrease their anxiety. Laryngeal trauma and obstruction are normally related to motor vehicle accidents or blunt trauma to the neck region. Assessment findings that you'll see is neck swelling, bruising, tenderness. You could hear stridor, hoarseness, cyanosis. Medical and surgical management would be providing a patent airway and the Heimlich remover. So if there's a total obstruction, what is the universal sign of choking? If you said clutching their throat, remember they have both hands over the throat, that's a universal sign that someone is choking. Nursing management, we're going to monitor their lung sounds, respiratory pattern, nasal swelling and bleeding, and monitoring their laryngeal edema. Next, we're going to talk about sleep apnea. There are a few different types. So First, the recurrent and frequent episodes of the upper airway obstruction and reduced ventilation. So there's 3 different classifications, which is central, which means the brain fails to send a signal to breathe. An obstructive means there is a obstruction, and complex means there is a mixture of both. The main thing we're going to talk about is obstructive sleep apnea. Assessment findings: they're going to snore loudly. They will stop breathing for at least 10 seconds. They awaken suddenly with a loud snort. They will have daytime fatigue, morning headache, inability to concentrate, sore throat, and some men may have an erectile dysfunction. The people at risk are men, women after menopause, African American and Hispanics. It can be hereditary, and it can be linked to smoking. Medical management, we're talking about how can we prevent this. Some main things we can do is lose weight, stop smoking, eliminate alcohol, and they can use special pillows to keep them elevated a little better. They can also use the CPAP or a BiPAP, which we talked about day 1. Nursing management is reassurance, adequate instruction, and explanation of the need for stopping smoking or the need to be on a CPAP or a BiPAP. You can also provide them self-help groups and counseling. Next, we're going to talk about laryngeal cancer. Common causes are those carcinogens, which are your tobacco, alcohol, or pollutants. Assessment finding is a persistent, progressive hoarseness. And remember, we've talked about this earlier, that usually this lasts longer than 2 weeks. That's why they want you to have further investigation if you've had hoarseness for longer than 2 weeks. They can also have swelling or a lump in the throat or neck. Some diagnostic studies would be a laryngoscopy, biopsy, a CT, MRI, or a PET. This detects the size and if the cancer has spread. Your surgical management would be chemotherapy, radiation, or a laryngectomy. Nursing management would assess for hoarseness, dysphagia, dyspnea, burning in the throat, anxiety level. We're going to provide coping strategies and make sure that they have an ability to communicate.